Hi, I'm Sarah. I'm a certified fascial manipulation specialist. I'm very fortunate to have travelled to Italy to learn with the Stecco Institute and currently only one of two in the UK with this qualification. I've devised a video to help you understand in simple terminology what fascia is and what dysfunctions can cause from fascia. Using slides, visual aids and just some general chatting, this video lasts for approximately 15 minutes. I hope you enjoy. Before we talk about fascia, let's have a look at what else is inside the human body. We have the skeletal system, providing support, muscles that help us move, tendons that attach muscle to bone, ligaments attaching bone to bone, many different organs within the body. The lymphatic system, there are many different types of systems. Cardiovascular system, the nervous system, and there are many more. Take a look at this picture. You will see a foot. On top of the foot, if you look carefully, you will see a white film-like substance. This is fascia. Fascia looks very similar to cling film. The second picture shows a piece of chicken. As you can see, I'm holding the chicken in the air. And how am I holding it? I'm holding it by its fascia. This clearly shows how strong fascia is. There are many different types of fascia within the body. Today we're going to discuss three. These three are seen to be the main ones. The first one is superficial fascia. Superficial meaning to the top, which is to do with the skin. As you can see, I'm pinching the superficial fascia. To explain a bit more of what's actually beneath the skin, please take a look at the next slide, which will break it down a bit further for you. As you can see, we have the skin, the three layers, the epidermis, the dermis and the hypodermis, hair follicles, fat cells, blood vessels, nerves, all embedded in the skin. Now you've seen the slide of the skin, we're going to talk very shortly about what is actually underneath the skin. So we have the lymphatic system. If you don't know much about it, it's basically a clean-up operation within the body. We have lymph nodes, which are under armpits, groin, under here. There's so many places that lymph nodes are. You'll see a diagram in a second to explain more. We have lymphatic vessels, and we have a system which is like a little Pac-Man system in operation that goes around munching up anything that's left in the body that shouldn't be there, and also helping for immunity, so keeping our immunity levels very high. So the lymphatic system is very important, and sometimes when we get puffy ankles, it means that the lymphatic system is not operating properly. So let's have a look at the next slide, and that will give you a visual idea of what the lymphatic system looks like. The lymphatic system consists of loads of lymph nodes. These lymph nodes you can clearly see in the picture, little dots all over the body. So now we've discussed the lymphatic system, also underneath the skin we have the adipose system and we have nerves. Now the adipose system is essential to help us keep warm because we have things called fat cells. Fat cells are all over the body and they can be quite dysfunctional, meaning we can get things like cellulite. Some people find that their body fat doesn't evenly distribute around the body, and that would be an example that you have more fat on your lower body than your upper body. We also have the metabolic system that needs moving, and that's part of the fat cells. So, you know, if you find that you can't put weight on or you're losing too much weight, again, that's to do with that particular system. So we talked about nerves. And nerves is really important. Raynaud syndrome, so that's when you have you can't hardly feel your fingers or your toes, or you just can't, your hands are always cold or your feet are always cold. So think things like body temperature again. We have skin conditions, psoriasis. We also have nerve pain itself, from which can give shingles. And if you've had shingles, you'll know that it gives you a rash. Sometimes it gives you a rash if you've not taken the appropriate medication. And this rash will be in line with the way that the nerves distribute within the body. Normally around the abdomen is the most common one, and that is a symptom as well of a dysfunction with the superficial fascia. So you've got all of that in your head now: lymphatic, adipose. We've also got the nerves as well. And now I'm going to talk about feedback loop. Feedback loop, otherwise known as homeostasis, is the body's way of helping regulate. An example would be that you go into a hot climate, the heat will penetrate the skin, and then somehow there are messages that are sent to the thalamus in the brain, telling the brain that it's really hot and I need to be able to cool down and adapt to this heat. So it then sends a little message back out and allows us to adapt. This is what's called a feedback loop. So now you've got that, stress on the body can change this feedback loop. We have different types of stress: external stress and internal stress. External stress, for instance, again, can be heat. It also can be the stress that's going on in your life, your work, your home life, anything and anything. Internal stress can be your nutrition, what you're putting in your body. Is it giving you stress on the organs? And with those two, they create a feedback loop that is continuously trying to keep up with these changes. But what happens is that if it regularly keeps going on, so with the stress, your feedback loop will just keep going and going and going, and it won't know any difference of what's right and what's wrong. Which is why sometimes when you are stressed, it is very difficult to get yourself out of that stage. It's because your body is still in that negative feedback loop. And why am I telling you this? It's because it's, again, to do with the superficial fascia. Remember what I said about external stress? Yeah, it's all about keeping the body regulated. So now you know about superficial fascia. We've talked about the lymphatic system, we've talked about the adipose, the nerves, we've talked about different types of stress. This is what can occur in the superficial fascia. Now we're going to talk about the second important one in the body, and that is called deep fascia. Now we get to talk about deep fascia, and for this I'm going to use a prop. This is my little friend. As you can see, he has some of his organs already missing, but for this I'm going to take a lung out of the body and I'm going to enclose it in some fascia. Now for the fascia, as we learnt about cling film earlier, this is what I'm going to use. Now remember that picture that you saw on the slide of the foot, you remember that shiny surface? So again, you're looking at this and you're getting the same kind of concept. This is called visceral fascia, and embedded in this fascia we have little neurons which are here, and what these do, they transmit and they allow the stretch of the fascia to take place. And the stretch is very important because it helps the motility of the organ happen. On the back of the fascia we have what's called parietal fascia, and the parietal fascia holds the organ into place. So you have two different types of fascia that I've gone through here. So, a question to ask you, and we'll talk about the intestines, which are here. If the Okay, so let's just wrap this around here first so you can get the idea. So we've got the fascia around the intestines and the stomach at the moment. The question is that when we die and our heart stops beating, do the intestines keep working or do they cease at the same time? Yes or no? So the answer to the question is yes. Yes, these will keep working for many hours after the heart stops beating. And the reason because of this is something called peristalsis, which is to do with what we discussed earlier, the neurons embedded in this fascia. Now this fascia is going to keep that going, and by me telling you this, it should make you realise how important fascia is within the body. Now, if we just put the intestines to one side for a second and we talk about other parts in the body that can have a dysfunction from the deep fascia, let's talk about the face just for a second. Sinusitis, a dysfunction, tinnitus, loss of sense of taste or smell within this area. These are all dysfunctions as well. When we look at other organs, we look at the uterus, heavy periods, no periods. We look at the liver, and there's dysfunctions there as well. So there's many other things that can go wrong within the body because there's not the correct tension or the stretch is not working appropriately on these organs. Now we're just going to go back to the cling film, as I said we would, just briefly to explain a bit more about the fascia. So we have the nice shiny surface, and if you looked at the picture earlier in the slide, you would see this clean like substance all over the actual foot. Now the thing is with cling film, it can be a pain because you can take it out the package and sometimes it's not smooth when you rip it off. Sometimes it gets tangled up and becomes dysfunctional, and that is the same with fascia. Fascia, if it's not smooth, will become dysfunctional, therefore causing a dysfunction within the body. So that is all about the deep fascia. Now we're going to talk about the last one, the epimysial. Epimysial is all about the muscles. Let's have a look at the next slide to explain a little bit further. The epimysial fascia is all about the muscles. As we can see from this slide, there are loads of muscles in the body that help us move when they contract. The next slide that you will see shows a breakdown of what the muscles look like inside. Clearly from this picture we can see the bicep muscle, and now we can see another diagram which shows us what's inside the biceps, the epimysium, the perimysium and the fascicles, which are inside, which are all about contraction. So you've just seen a picture of the epimysium, which is the fascia that surrounds the bicep muscle, and you also saw in that diagram the perimysium and fascicles. Now fascicles are really important because they also have fascia embedded around each one. Fascicles are the ones that give the nerve impulses, so they allow us to have the contraction of the muscle. And if this fascia, for whatever reason, is not working properly, then it will interfere with that impulse and therefore cause a dysfunction within the movement of that particular muscle. Now we also have fascia around some of the bones, the wrists and also the ankles, and they not only are there to help support and stabilize, but some of them are there and they don't actually have ligaments. They are there to be that ligament of that particular joint. So with that in mind, I want you to just think about the direction now that fascia moves. This is relevant because if you think about when you go on a train journey, your journey either exists of just taking one line or sometimes taking two or three.
And fascia is very similar with this concept because it just doesn't go in one line, it goes in many different lines. And an example would be that this arm is connected to my opposite leg. Now, what does that mean exactly? If you're a badminton player and you're using this arm all the time to play, eventually, if your fascia is tight because it's moving down to the opposite leg, it may cause a dysfunction with that other leg, or vice versa. If you're always using your right leg to lunge forward when you play sport, it may cause a tightness and therefore cause a problem with the arm or the shoulder. Now, dysfunctions within fascia, within musculoskeletal or joint, can be pain. Pain can be referred. Pain doesn't necessarily have to be where the problem is on the area. Example would be, I have a pain in my bicep, but I don't remember hurting my bicep. Or a blockage in the movement. And another example would be frozen shoulder. Sometimes we wake up with frozen shoulder, we don't know how we've got it, and the doctor says that's frozen shoulder, which is great, but how did I get frozen shoulder? Well, that could be because the fascia is tighter somewhere else and therefore is pulling around the shoulder, which doesn't allow it to move its correct movement. So that's really the kind of dysfunctions we're looking at. And we've got injuries that can play an event in that. We've also got operations as well. So we've talked about all three different fascias. Remember, they're all linked together. They don't stop like a train line when you get on the beginning and you get off the end, because you can come back again. They are all very connected, which is why if you have constipation, it may affect some muscular part in your body. So now we're going to look at a slide of dysfunctions, and there are many, many more, but we'll give you a brief idea of what I've seen in clinic.
Here we have a list of dysfunctions. It would be almost impossible to list every type of dysfunction that fascia can cause, but we will go through a few that haven't been talked about already. We have diabetes. Diabetes can be caused from superficial or deep fascia dysfunction. Kidney stones from deep fascia. Jaw problems from superficial fascia or the epimysial fascia.
Okay, so that's it. Thanks very much for watching, taking the time. And if you have any questions regarding the treatment, or you're interested, or you want to know a bit more, please get in touch. Have a great day.
Here is a list of dysfunctions. It's only a small list. There are many, many more things that can happen. But just to go through a few that we haven't gone through already, we have on here period problems and fertility. Now, as I explained earlier, the fascia goes around the organs. The uterus is an organ. If the fascia is not the correct tension, it will cause issues. We also have urinary issues. Same thing. We also have jaw problems. Jaw problems, tightness within the jaw in the fascia can be really horrible for someone that's suffering. Making them wear a mouth guard at night so they stop grinding their teeth. Jaw problems can be resolved with fascial manipulation. We also have athletes' repetitive movement in sport. And what this means is some athletes are continuously putting their bodies under the same stress day in and day out. And what this means is the fascia has no rest and therefore causes a dysfunction. It can then cause a dysfunction within the rest of the body. So the idea is that if this is you, then it's important to come in and have treatment to ensure that your fascia is the correct tension. There's other things on there, nerve pain, so that could be anything from sciatica to pain on the skin, which has resolved from shingles. We've got frozen shoulder. There's loads of things. Please feel free to get in contact if there's something that you're suffering from and you're not exactly sure if fascial manipulation can help you.